The tragedy of losing a loved one unexpectedly during the holidays is just devastating. And this is the time of year when heart attacks spike.
But how do you know if what you're experiencing is a heart attack or something else? John Shumway checked in with the American Heart Association. So, John, we want to learn what you found out, but I know you also have a very personal reason for doing this story.
Yeah, the subjects I feel very strongly about. I lost my dad to a heart attack on Christmas Day, and I've always wondered if there were symptoms that he didn't recognize or that he ignored.
With so much going on during the holiday season, it's easy to be overwhelmed by the stress. Panic attacks, complete with heart fluttering, happens. But is it panic or a heart attack?
It can be difficult to tell the difference sometimes. So the classic symptom of a heart attack is chest pain.
Dr. Mitchell Elkin is the Chief Clinical Science Officer for the American Heart Association. The chest pain of a heart attack is clear in its intent.
A pressing chest pain, like an elephant sitting on their chest. Sometimes, though, people don't have that symptom. They may have pain in the arm, the neck, or even the jaw. Commonly, people will have some shortness of breath or trouble breathing. But sometimes people only have some nausea and break out in a cold sweat and feel lightheaded, dizzy, and may feel those palpitations like a panic attack.
Any of those symptoms, Dr. Elkin says, drop everything and get checked out.
If it is a heart attack, you want to get treated as quickly as possible.
The American Heart Association says Christmas Day is #1 for heart attacks. The day after is #2, and New Year's Day, #3. Dr. Elkin can't emphasize enough the need for immediate care because a subtle sign can quickly become a heart attack and then cardiac arrest.
It only takes 3 minutes or so before the brain is deprived of enough oxygen that the injury is irreversible.
Now, because we tend to eat a lot and drink a bit around the holiday, indigestion is also very common. But that can also be the start of a heart incident. So you need to listen to your body and don't ignore it.
Certainly know your body. John, in your situation with your father, was there ever a prior history of heart trouble? We always ask ourselves, is there any genetics with this?
Right, and no, there was no prior history. And you know what, that's not uncommon. If you have survived a heart attack, you tend to be more inclined to react to the symptoms if you feel them again. If not, the denial factor plays a role, and that could delay treatment. In my dad's case, I don't really think we delayed. In fact, the doctors told us he could have had that heart attack in the hospital, and the outcome wouldn't have been any different.
Wow.
Oh, wow. Thank you for sharing that, John.
Absolutely.
And really, because it makes people more alert, and it takes away the idea of I'm embarrassed. Yeah. If this isn't a heart attack, go get it checked out if you have any doubt at all.
Exactly.
Yeah. All right. Thank you.